Returning now to our top story, masks have again been mandated indoors in New South Wales, and new rules also apply to hospitality venues as the state tries to slow the spread of Omicron. Joining me now live is the Deputy Premier, Paul Toole. Deputy Premier, thank you for joining us this morning. Did the state take too long to make a decision on mandating masks?
Well, I don't think the state did take too long, Nika. I think this is a decision that was made by advice that we received from health, but this is a measured response. I mean, I've been walking around, I've actually been looking at people that have been indoors, and a lot of people have already been taking that personal responsibility and wearing masks. What we've done is we've made it uniformed across the board so that for anybody now that's going to be indoors, in retail, you are wearing a mask, and that's going to come into play now, and it'll remain until at least the 27th of January.
It was very clear from the Chief Health Officer, Dr. Carrie Chant, that she highly recommended that masks be worn indoors. Did Dominic Perrottet perhaps ease restrictions just that week too early?
Look, I don't, I think it's the right decision. I mean, we have to actually strike the balance. We've got to strike the balance between making sure, firstly, that we keep people safe. Secondly, we've got to make sure that we still keep the economy ticking over. But what we have done here is, made sure that by introducing masks, by changing some of our density settings, this is about keeping people safe. This is about striking the right balance. And, at the end of the day, I think this is the right decision. It's a measured approach, but it's also in a step in the right direction.
The restrictions are due to end on January 27. Can you give a guarantee that they won't be extended beyond that date?
Well, I think we've actually given a clear date so that the public knows what they can expect over the next month. What we'll do, though, is we'll continue to have a look at those numbers when it comes to hospitalisations, when it comes to ICU beds. That'll be the numbers that we'll be reliant upon if there are any changes to be made. I mean, here in New South Wales, we should be very proud of where we are today. People have had a tough year. They've come forward. They've followed the advice that has been given. They've got double vaccinated. That's why we're seeing very low numbers in hospitals. I think yesterday we saw around 45 people that were in ICU beds, and the majority of them are people that are unvaccinated. So it clearly shows that if you are vaccinated, if you go out there now and get your booster, this is the best way of protecting yourself and stopping the spread of the virus.
In terms of booster shots, particularly in regional New South Wales, is there sufficient supply in the regions?
Look, our supply is not our issue at the moment. We have plenty of supply. So whether that's in the city or out in regional New South Wales at the moment, what we do know is that there is extreme pressure on our GPs. We also know that a lot of them are going to be taking a break over the coming weeks. Some of them have got holidays. They haven't had a holiday for over 12 months, 2 years in some cases. So the issue is not supply. The issue is about ensuring that we can get those booster jabs into arms as quickly as possible. We've also got pharmacists that are on board as well. So I encourage the community to have a look at where they can actually receive their booster. Don't put it off. Go and get it done as quickly as possible to protect yourself. Supply is not an issue.
We also saw nurses walk off the job in the regions a few weeks ago. Are you confident that nurses will be able to cope with the outbreak in the regional areas?
Yeah, look, I think that's, one of the things that we're always monitoring is our health system and actually seeing how it's holding up. And there's no doubt that the health system is under enormous pressure at the moment, but that's because it comes to staffing shortages. I mean, about a week ago, we had around 300 staff that were off. This week, we're looking at around 1,500 staff that are off. So that puts enormous pressure on our clinicians, on our health professionals to supply the services that are required in our hospitals and in our medical system around the state. That's why we're asking people, not to just come forward and get tested for the sake of it. Only get tested if you have any flu-like symptoms. Only get tested if you're instructed to do so. And then we're able to get the results back a lot quicker for those people that actually need to know that information in a timely manner. I mean, our health professionals, they've been amazing. They've been out there all year round protecting our community, working tirelessly. New South Wales health system has been gearing up for this. We've got plenty of resources, but we want to make sure that we keep our staff on the ground to ensure that support is provided.